Typical day in the GP practice really varied, sort of changes from day to day, depends on what's going on. I think a job in a GP practice depends on what the GPs want you to do and the type of patients you see, the area you work in. So I tend to see more patients, adult patients with sort of long-term health conditions. So that could involve medication reviews. I do a lot around starting anticoagulants. Reviews could be over the phone. They could be in patients' houses. I work a lot with care homes. Work closely with a pharmacy technician as well. So she actions all our clinic letters and our discharges. So I would then do all the clinical checks and support her with any queries that she might have. Really embedded in the team. So you have to be there sort of visible. If the GPs knock on your door with any questions, if any of the other team knock on your door with any questions. So totally varied, dealing with what turns up on the day. What I enjoy most about my job, I would say definitely it's just really rewarding. I think just getting to know patients, them getting to know you, you feeling like you're making a difference in the area that you're working in. So yeah, 100% rewarding work. I also love being part of a team. It's a very social place to work. You feel really sort of part of the team. It's quite a fun day working there. Rewarding, part of a team, job satisfaction, it's interesting, there's a lot of problem solving, so you feel that there's a sense of achievement there and you've really sort of made a difference. I used to work in community pharmacy before I moved into work as a pharmacist in a GP practice. And when I started out in community pharmacy, working in a GP practice as a pharmacist wasn't really a role. It's only really, I suppose, become established within the last 10 years. So it was a new role and just something that I was really sort of keen to get involved with and try something new. So that's sort of how I sort of ended up there, really. And I worked in various roles within primary care. So started off as a prescribing advisor, working for the health board. Then I moved into a role as a cluster pharmacist. So that was working across a few different GP practices. And then one of the GP practices I was working as a cluster pharmacist wanted to employ a pharmacist. So they asked me if I wanted to come and work for them, which is what I did. Anyone wanting to work as a pharmacist in a GP practice, I think it's just about just trying to talk to people who are doing the role now, just to find out a bit about what they do. Because as I say, it varies from GP practice to GP practice. There's lots of variations of roles within working as a pharmacist in primary care setting. Maybe trying to organise some work experience or trying to shadow somebody just to get a real feel if you think that you would actually enjoy the job. And I think once you do decide that that's the role for you, there's a lot of support and sort of structured programmes to help you move then into that area of pharmacy. So yeah, a typical day at work is really varied, and I think that's partly why I enjoy about it. There's never really a dull moment and it goes past in a flash. What you tend to do as a pharmacist in a GP practice will depend on what your GPs want you to do, the type of practice you work in and the type of patients that live locally. So I tend to see more adult patients with long-term health conditions. So a lot of my work would involve medication reviews. So, for example, patients with mental health conditions, heart disease, high blood pressure. So yes, reviewing those medications. It's stopping some medications, starting some medications, optimizing doses of some medications. I also prescribing some areas. So for example, blood pressure medication and anticoagulants. So that would be initiating certain medications from scratch. I do a lot of training as well. So I work in a GP practice that also trains GPs. So I get involved in some of the training. And we also have pharmacy undergraduates coming to the surgery. So I help support them as well. Other aspects of my role, I work really closely with my pharmacy technician. So I support her with any queries she might have. For example, on clinic letters or discharges. I also do all the clinical checks for those. I also issue acute medication requests for certain patients. And I also request and interpret some blood results as well. And a new area I got involved in is managing our transgender patients, so ensuring that they have all their annual reviews and all their monitoring and screening and everything is in place. So I think the role is always evolving. There's always new areas to get involved with.